Ask someone what a complete denture is, you'll probably get a simple answer. False teeth.
Right. That's the common understanding.
But when we started looking through the clinical documents for this deep dive, the patient FAQs, you find this really complex story. It's about material science, jaw mechanics, and some pretty critical long-term biological facts.
It's so much more than just filling a gap. It's a functional compromise.
Exactly. And we've all seen the pictures, right? The stunning before and after shots that promise this perfect, confident smile. But our mission today is to look right past that.
To get into the fine print.
Yes. We're going to unpack the trade-offs, the real benefits, and really drill down into the very demanding long-term care that everyone has to know about.
So maybe we should start with a clear definition. What are we actually talking about here?
Good idea.
A complete denture is a removable appliance. And that word removable is key. It's not cemented in. It's designed to replace all the teeth in one jaw, upper or lower.
And the goal is twofold, I gather. Restore the look, but also restore function.
Restore appearance and bring back at least a baseline of function. That's the goal.
Okay, so let's start with the basics then. What are these things actually made of? And why is this still the most common choice for so many people?
Well, the structure itself is pretty simple but clever. You have a base, which is usually made of a pink acrylic.
That's the part that's meant to look like your gums.
Exactly. It's designed to blend in. And that base rests on whatever jaw structure is left. Then, of course, you have the teeth.
The part everyone sees.
Right. And those are typically made of a high-quality, tooth-colored acrylic as well. Sometimes porcelain, but that's a bit less common these days.
And the immediate appeal, it's obvious. You get your smile back. But the sources we looked at kept pointing to one huge driver.
The economics of it.
The economics. It's stated very clearly as the most cost-effective way to replace all the teeth in one jaw. And that fact alone, I think, really dictates why this is often the first path people take.
Absolutely. Yeah. The initial cost is the primary advantage. But there's another aesthetic benefit that's, it's a bit more subtle.
Oh.
The physical bulk of the denture, the acrylic base, it actually provides this really important underlying support for your facial structures.
You mean for your lips and cheeks?
Especially the lips. It rebuilds that foundation that was lost when the teeth and their roots were lost. It can prevent that sort of sunken look you sometimes see.
So it's not just a smile fix, it's a profile fix. It helps maintain a fuller facial shape.
Yes, it connects the internal structure directly to that visible, more youthful result.
Okay, so let's unpack this, because this is where the conversation, I think, takes a really sharp turn, away from aesthetics and into the hard reality of, biology and engineering.
This is the crucial part.
We have to talk about the functional limitation, because it's probably the biggest caveat in all the material we reviewed. Even with a perfect fit, there's a serious warning about performance.
And that warning is central to this whole deep dive. The clinical reality is this. A complete denture, no matter how well it's made, it does not and cannot have the same chewing efficiency as natural teeth.
It's just physically impossible.
It's physically impossible.
Why, though? They look pretty robust. Why is the efficiency so limited?
It all comes down to one word.
Yeah.
Anchorage. Your natural teeth are anchored individually. They have roots that go directly into the solid bone of your jaw.
Right. They're locked in.
Locked in. A complete denture, on the other hand, it's just resting. It's a removable appliance resting on soft, resilient gum tissue. I sometimes think of it like this. A natural tooth is a house bolted to bedrock.
Okay.
A complete denture is more like a carefully shaped raft floating on water.
I love that analogy. A raft. Okay, so all of its efficiency then depends on how steady you can keep that raft.
Precisely. The success of the whole thing depends on three interconnected ideas.
Yeah.
Stability, support, and retention.
Okay, break those down.
Stability is about resisting movement, side to side, front to back, when you're chewing. Support is how well the tissues underneath can handle the biting load. And retention. That's the suction, the ability to resist being pulled straight off.
So what you're saying is the patient's own anatomy sounds way more important than the plastic device itself. If the success relies on those three things, what makes them successful for any given person?
It is entirely dictated by the patient's own biological landscape. That's the foundation. We're talking about the amount and type of jawbone they have left, the quality of their gum tissue, even the amount of saliva.
Saliva?
Oh, yes, saliva helps create the seal for that suction, for retention. But the biggest thing is the shape of the jaw itself, what we call the edentulous ridge.
That's The area where the teeth used to be.
Yes, and if that ridge, that foundation is flat or has shrunk away,
And the wrap has nothing to sit on securely.
absolutely. The denture can only ever be as stable as the surface it rests on. This is a huge problem, especially for the lower jaw, where you just have much less surface area to work with.
And all of this leads right into the physics of chewing and the problem of force. The materials we saw explicitly warn about uneven or excessive biting forces.
They are a critical risk factor because the mechanics are always, in a way, working against the device. When you chew, that denture is always going to rock a little bit. It has to. It's on soft tissue.
It's not bolted down.
Exactly. So if you chew unevenly or bite into something too hard, that uneven pressure makes it lift or rock way more dramatically.
And I'm guessing that rocking motion is what leads to the physical damage mentioned in the source material, the fractures and wear.
That's exactly right. Excessive rocking causes two big problems. First, it's uncomfortable. It creates sore spots. And second, it causes accelerated wear or even fractures of the acrylic base or the teeth.
Yeah.
You're grinding the device against your own anatomy.
So we have this device that it restores the look, but it's fundamentally limited by your jaw's biology. And then it's challenged every single time you try to eat.
That's a good summary.
Which brings us to the real world stuff. Post-treatment life, the maintenance, the fine print.
And this is where the long-term commitment really starts to become clear. First, because the materials aren't as strong as natural tooth enamel, just can't chew as heavily on them. That's the first adjustment.
And then there's the rule about tissue health. This was the detail I found most surprising, and I bet it's the one most often overlooked.
It's probably the single most important rule for long-term oral health. The denture must be left out of your mouth while you sleep.
Hey, is that so non-negotiable? Can't you just clean it really well?
It's not just about cleaning. The tissue underneath the denture, the gums, it needs to rest. The constant pressure and coverage from that acrylic base restricts blood flow. It restricts airflow.
So it's like wearing a bandage 24/7.
A restricted bandage, yes. If you don't give those tissues a break, a chance to recover, your risk of inflammation, bacterial and fungal growth, all of that goes way up. The overnight rest is essential.
So it's about giving the biological foundation a chance to breathe, basically, to recover from the day's pressure.
Precisely. And that practicality extends into the daytime, too. Because the denture covers so much surface area, especially the palate on the upper jaw, food gets trapped.
I can just imagine. So that means you're probably taking it out to clean it more than just morning and night.
Oh, frequently.
Yeah.
The sources confirm that for many people, removal and a full cleaning might be necessary after every single meal. You have to take it out, rinse your mouth, make sure nothing is trapped between the acrylic and your gums.
Wow. Okay. Now let's get to the long-term maintenance. This ties right back to the stability and retention we were talking about. You said the jaw is always changing, so what's the mandatory schedule for dealing with that?
This is the non-negotiable professional part of the commitment. See, when you lose your natural teeth, the jawbone begins to resorb. It slowly shrinks because the tooth roots aren't there anymore to stimulate it.
That's the constant subtle transformation.
Right, and as the bone and gums change shape, the denture that was made a few years ago, it just doesn't fit anymore.
The foundation shifts, so the wrap doesn't fit the water anymore.
Perfect analogy. The fit gets worse, the suction is lost, stability plummets. So to fight this, the fit must be reestablished every 2 to 5 years.
And how do they do that?
It's a process called a reline. Essentially, a new layer of acrylic is added to the inside surface of the denture, perfectly contouring it to the new current shape of your gum.
2 to 5 years. That's a critical piece of information. This isn't a one-time purchase. It's a long-term commitment to periodic adjustments just to maintain that baseline function.
And if you skip them, the problems compound. The fit gets worse, the rocking increases, chewing gets harder, and a poorly fitting denture can actually make the bone loss happen faster because it creates these bad pressure points.
So that raises a question for me. If the complete denture has all these functional limits, this really rigorous daily care, and this non-negotiable adjustment schedule, why is it still the standard first choice? Is it really just the money?
Predominantly, yes. It's the most accessible path to getting your appearance and some function back. But the sources do, of course, acknowledge there are other options.
For those who need or can afford something with better performance.
Exactly.
So what are the alternatives listed in the source material?
There are really two main alternatives mentioned. The first and simplest is just leaving the mouth as it is, except in the consequences of having no teeth. Some people do choose that.
Give me a second.
The second, which is really the gold standard for function, is implants. Dental implants, they're titanium fixtures that are placed directly into the jawbone, and they act like artificial tooth.
So they give you that anchorage that was missing.
They give you the anchorage. They can be used to support individual crowns and bridges, or, and this is interesting, they can be used to anchor the complete denture itself.
So a hybrid approach. You keep the removable denture, which is easier to clean, but you clip it onto implants.
That's right. You turn that floating raft into a structure that's securely snapped onto posts. It dramatically increases stability, retention, and chewing power. It mitigates the biggest functional trade-off, but of course, at a significantly higher initial cost.
So what we've really uncovered here is a clear trade-off matrix for you, the listener. A complete denture is the most cost-effective way to get your appearance and basic function back.
But it comes with that mandatory maintenance. Out at night, cleaned after meals, professional relines, and the acceptance that your own anatomy is the ultimate decider of your success.
And on the other hand, you can invest more upfront in something like implants to get far superior stability and function.
It's a balance of cost versus performance.
So here's the final thought we want to leave you with, and it connects back to that constant biological change we talked about. We've established that the fit of a denture has to be redone every few years because the underlying bone and gums are shrinking. They're atrophying.
That process is always happening.
So if that slow, constant bone loss is happening anyway, what are the long-term effects for people who choose that other alternative, the one where you just leave your mouth as it is?
Well, they face accelerated changes. Without any appliance, without any stimulation at all, that bone loss can continue unchecked. It can change the very shape of their face over time.
And I imagine it could make it much harder to get any kind of restoration later on.
It can. It can complicate future attempts, even with implants, simply because there might not be enough foundational bone left to work with.
So it's a crucial question to think about. What's the true long-term biological cost of doing nothing compared to the active commitment that maintenance requires? Thanks for diving deep with us.